today I'm going to be talking about pods, pills, and partnerships and the steps we've taken to reach our Oz. We'll be talking about the path that we've taken to accomplish our SNS and preparedness activities by setting the stage and talking about the background information, writing the script and how we made our plans, and the cast of characters or the partnerships that involved to put all the pieces together to have an operational plan. As I mentioned earlier, we're the largest local health department in Colorado, serving over 1.3 million people across 3,000 square miles of densely and rural populated areas. We also support Elbert County, which is a rural community due to the limited resources that they have. The complexities in planning for SNS and pods is challenging our jurisdiction of its size and makeup. Colorado is also a home rule state, and locals are free to pass laws and ordinances within the bounds of the state and federal ordinances. With 3 counties and 26 municipalities, we not only work with our partners at the county level, but we also work with our local municipalities as they have that ultimate decision-making power regarding planning in our jurisdiction. So local planning challenges include that the state provides guidance and support, but they don't have the authority to dictate what happens. And all the agencies that we support are very different, so we have to accommodate all of the different intricacies. Like many jurisdictions across the U.S., we've implemented pods with H1N1 and even with the hepatitis A exposure. And with all of this planned implementation, lessons learned, and the use of data-driven tools, we fine-tuned our efforts to help respond best in a large-scale disaster. We've established that we would need 3 local transfer points to receive all SNS medications and supplies, 14 pods, closed pods, the use of our military installation to dispense medications within that 48-hour time frame. We've signed agreements with multiple school districts, community colleges, and public venues for use of space and resources, and we integrate all of our plans with emergency management, law enforcement, EMS facilities, and behavioral health to ensure that we have a standard operating procedure where we're looking at the whole picture. So just like the slippers that are the tool to get Dorothy home, pills and vaccines are what protect our communities in the event of a large-scale emergency. And just as Dorothy had her slippers through the whole story, the federal government stockpiles assets we need to allow us to respond after a disaster. So for the population we serve, we estimate that it would take approximately 118 pallets to serve our population, which is a large amount of square footage. And while we have small storage space at our agency in the local health department, we just can't do this alone. So we've developed rigorous agreements with our county partners to provide the space, the personnel, the warehouse, the supplies, and even financial support, with agreements that have been formalized through study sessions with our elected officials, where we've agreed to mutual goals and responsibilities to serve our communities and to protect the public. It'll take a Herculean effort to mobilize, transport, and support the distribution of SNS assets across our large service area. Because we cross multiple jurisdictions, special consideration has to be given to security, as law enforcement will need to cross jurisdictional boundaries to most efficiently protect our assets. We cannot do this work alone, but rather it takes integration and coordination among all key partners who would be supporting this public health response to a large-scale incident. So we have multiple venues where we meet with our partners on a regular basis to ensure collaboration and coordination of our planning and response efforts. We have a healthcare coalition made of internal partners in preparedness, disease control, and nursing, along with partners in health and medical, emergency management, and first responders. We meet quarterly, and then in addition, we work in special working groups for incident-specific planning. Further, Tri-County serves as that Emergency Support Function 8 lead in our jurisdiction, which means we coordinate resources and information related to the health and medical components of an incident, and we support our hospital, coroner, and behavioral health partners in facilitating their response as well. An incident affecting Tri-County would also affect our counties in our greater 10-county North Central region, and coordination of pod operations and public messaging is key. Staffing is a major challenge, and we have a mutual aid agreement throughout the state to coordinate the sharing of resources and support, and we've done this in the past. The emergency preparedness and response community has strong multidisciplinary partnerships, and in our counties, we have a strong, supportive, integrated relationship that ensures operational support despite the inability of local health departments to financially support this. All Tri-County Health Department staff are designated as first responders, and we're trained in incident management. But even with all of this, we rely on everyone's subject matter expertise to help do all components of mass prophy planning. And this allows us to work smarter in how we institute a complex operation like pod operations. It takes the buy-in and support of all levels of leadership to support our efforts all the way up to the elected officials. And while there are challenges to build strong relationships, we feel we've done this very successfully. It takes courage and leadership to get them to all work together in a coordinated and productive manner, and we believe we have accomplished this to the benefit of our entire service area.